Hey guys, this is Dan. Today is July 7th, 2012, and I am 2 weeks and 2 days post-op with Dr. Leis. So you're looking at me right now in most goofy state with a phone book on my chest, as you can see. Um, so before I show you guys my chest, I'm going to talk a little bit about what's been going on with me since I've had surgery, since I haven't really done an update since I first got surgery. So within the last 2 weeks, I've gone to see Dr. Leis twice, and no wait, 3 times. Yeah, I've gone to see him 3 times. Once exactly the week after my surgery, where I got 130 stitches removed, and he put, the little sticky things on there to keep everything in place, which I had on for a few days. They're gone now, and he had to actually put my nipple back on, sew some stitches in there. He was kind of concerned. Apparently the blood flow on my left side was not as good as my right, which is kind of creepy because I'm asymmetrical. But yeah, medical mystery. So that was week 1. And then I noticed some fluid build up. You could touch that side of my chest and you would see fluid move underneath the skin back and forth. So I called the office and I went back in, and he drained 75 cc's of what he called old blood on Wednesday, which was, let's see, it's 4 days ago. So he drew the old blood out by injecting anesthesia, putting in a syringe up there and draw it out. He said it was old blood because it was dark. So that was pretty good. But then he put me back in a compressor and told me that if I saw any fluid at all, I had to call him. And within 24 hours the next day when I woke up, I took off the compressor to apply some antibiotic ointment to my left nipple, which is not doing so well because of the lack of blood supply. And I saw that there was, again, noticeable fluid buildup. I ended up going back to the doctor 2 days after I went on Friday. Again, he drained 25 cc's, and he said this time there was a little bit of clear liquid in there. I'm still in the compressor. He told me to put a phone book over top of the compressor to keep it even more compressed, because it was kind of crazy that my body's still generating all this fluid underneath the skin with compressor on. Just my left side, by the way. My right side's doing incredibly well. So that was yesterday. It's now Saturday. And I woke up again today, and there's just a little bit of fluid. Nothing like before. Before the first day when he drained the 75 cc's, he wanted me to make sure I was immobile and all this crazy stuff. Sorry, I forgot what I was saying. My girlfriend said something. Alright, so I guess I'll get to it and just show you what my chest looks like and what the compressor looks like before I go shower. So there's a bunch of sunlight over there. So this is the binder compressor that he has me in, and right now I am doubling it because it goes down too far, and he wants that added pressure, so I'm gonna take it off. It's slightly difficult. And this is my chest 2 weeks post-op. As you can see, like I said, there's I'm gonna take this pad off and show you my right nipple so far is doing great. There you go, see that? That's my scarring, and then right now the left nipple, like I said, is not doing as good. It's pink now, so the nipple graft has taken. I'm gonna show you that. So, you know, it looks kind of scary right now. Right here we have a scab, which he told me to keep the antibiotic ointment on it, and, you know, then it's just going to eventually fall off and new skin will grow over that, so that, although it looks kind of crazy, will be fine. And, the nipple graft now, there's a little bit of yellow right there. That's not pus. I forget exactly what he said that is. He said that's completely normal for it to sometimes get yellow. If you look at it, though, now the nipple itself is pink, which means that the graft is taking incredibly well, opposed to what it was doing two weeks and 2 days ago. So now I'm going to show you a little bit what I mean about the fluidity. If you could see, when I don't know, just around the nipple, it kind of, if you look over here, it will kind of move. I don't know if you can see it or not. It's not anywhere as bad as it was a few days ago. A few days ago it was about, oh, there you go. You can see it move over there. So that is not good. That's why I'm in the compressor, opposed to this. That's not happening. See? You see right there. Alright guys, so now that I've talked a lot, 2 weeks and 2 days post-op with Dr. Leis, telling you some minor problems, but other than that, for the most part, it's great. Later.